It's Charles Barkley with Wayfair. It's outdoor season, and my patio setup better be ready to play. That's where Wayfair wins. Patio seating, umbrellas, and grills, all delivered fast and easy. Shop wayfair.ca now.
Wayfair, every style, every home.
Oh, 10:51. Almost skipped an hour. 10:51 right here on CJAD 800. Canada's premiers gathering for a 3-day conference to ask for an increase in healthcare funding, among other things. Currently, Ottawa funding 22% of provincial healthcare. Premiers are asking to have that bump to 35%. Will they be successful? Should they be successful? Let's discuss. Charles Breton's on the line, Executive Director of the Centre of Excellence on the Canadian Federation at the Institute for Research on Public Policy. Charles, welcome to the show.
Hi, thanks for having me.
So let's discuss what's happening right now with the meeting between Canada's premiers. First things first. When we talk about the goal here to get more money with regards to healthcare, how much of a point do the provinces have?
I mean, they've been repeating the same point even before the pandemic, asking for what you just mentioned, moving from 22% of the cost covered by the federal government to 35%, in the form of what is called the Canada Health Transfer, which is the biggest transfer of money from the federal government to the provinces. We often talk about equalization, for instance. Well, the CHT, the Canada Health Transfer, is more than double what equalization is. Not in all provinces, of course, but total for the country. So it's massive. It's $45 billion this year. So they've been repeating that point. And part of the reason why they want to see this funding increased is that this money comes without any conditions. There are some conditions, but they're very minimal. It's to respect the Canada Health Act, which is not that difficult to do for the provinces. But other than that, they can do whatever they want with that money. They can even spend it on other things than health. Like there is no tracking of what that money is being used for. Mm-hmm. And so it gives them a lot of options, and that's what they want. And I understand why they're asking that. But at the same time, they've been asking for this for many years. They haven't really changed the record on this, and the federal government, the current one, has been pretty clear that they're not going to do that, and they want to see improvement in specific aspects, and they want to make sure that the money is used to improve healthcare. So, do they have a point? They do in a way, because we all know that COVID was really hit the healthcare system across the country very hard. And there are definitely a lot of issues that need to be addressed, and more money will be needed. Where it's coming from, whether there's strings attached or not, I mean, this is a political debate that needs to happen. But they do have a point that we'll need to invest more. At the same time, we've been investing more every year since like the early 2000s and haven't really seen any results. So just more money probably isn't the solution to our problems. Mm-hmm. It sure probably helps, but it's not the only solution.
When it comes to strings attached versus no strings attached, mm-hmm. do you think one side's right here?
I mean, everyone wants to be able to set their own conditions or own priorities. And there are, it has happened before. There are precedents here in the sense that just in 2017, for instance, the federal government said here's I think it was about $11.5 billion we want to see invested in mental health, in long-term care, in home care. The provinces said no thanks. The federal said, well, this is our last offer. And then you saw some provinces who really needed the money, like New Brunswick and Nova Scotia, say, wait a minute, we need this money, so we'll agree to some very general conditions. Then every province has agreed. The requirements and the conditions vary by province because the context is different, and everyone came to the table and agreed. So it's possible that that's what we see here at some point, a series of bilateral agreements with provinces, similar to what we saw, for instance, for childcare. Quebec already had a system, didn't have any conditions. Here we'll have to see what it is that the federal government wants to see. But again, it's understandable that the provinces don't want any conditions because they want to be able to drive what the priorities are. it makes sense for the federal government to say that's a lot of money and we want to make sure it goes to ABC. And so we'll see what the outcome here is. But again, there are some provinces, Newfoundland, New Brunswick, for which like the public finances are in a dire situation, and then they're likely to move first just because they will need the money. And importantly, we know what at the end of the day what Canadians want, because it's their money. Whether the federal government says it's our money or the provinces says it's ours, at the end of the day, it's coming from Canadians.
Yeah.
And we know we have data, like the group that I lead, we have an annual survey that we do on questions like this, and we know that Canadians want to see more funding in healthcare. We know that they want it, even if it means an increase in taxes. We know they want it, even if it means bigger deficits for provinces or the federal government. And we know that there is a sizable number of Canadians who want to see those transfers come without conditions, especially in Quebec. But in all provinces, there is at least 30% of people who want to see strings attached with that money because they don't trust their provincial government to deal with the issues in healthcare.
With Charles Breton from the Institute for Research on Public Policy, talking about the premiers meeting, their demands for more money in healthcare. Charles, listen, if a government can say you need to spend the money on something, what's to stop them in the future? Maybe a conservative government, another government in Ottawa. What would stop a government from telling provinces, well, here's what you can't spend it on too? Yeah.
That's a good point, and that's one point that the provinces clearly have, is to say what we want is clarity, and we want something that's stable because we need it to plan out the future, right? And if we sign to a deal, we want to make sure that if there's a new government, we're not going to lose that money, because it happened before. Yes, the Canada Health Transfer has increased every year, but the rate at which it has increased hasn't been always the same, right? It was 6% per year before, and then the Conservatives dropped it, and now it's 3.5, 4.5, depending on the year. So there is an element of instability as to what will happen in the future. And here the provinces have a point. We need to know what we'll be able to count on 5 years down the road. And so at the same time, that might be a reason to sign a deal, because if there is a deal in place, then every parties are agreed to that deal. Even if there's a new change in government, maybe the priorities will change. But if there was a signed agreement for, the next 5-6 years, well, there is a signed agreement, and parties will respect it.
It's so fascinating, Charles, and we didn't even get into the whole other facet of this, where you've got very popular premiers like Doug Ford and François Legault, and how they can sort of pull their weight in this whole discussion. Charles, thanks for coming on this morning.
You're welcome.
That's Charles Breton, Executive Director of the Centre of Excellence on the Canadian Federation at the Institute for Research on Public Policy.